Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas, and this is COVID-19 Pandemic World News, brought to you by Triple N Media, Houston, Texas. In this presentation, we are going to look at why do we need a COVID booster shot, and if we do, when would we need the COVID booster shot? So let us dive right into the main topic. As of August 11th, 2021, United States has recorded more than 37 million cases of COVID-19, accounting for 635,257 deaths. And as you can see in the graph here, the number of cases are going up exponentially. The highest recorded was in the range of 132,000 cases just a couple of days ago, and we still haven't seen the peak or the plateau of this bell curve. As you can see, this wave is much bigger than the one we had last July and much bigger than the first wave we had in New York and other places across the United States. So that is a significant jump in the number of new cases, and 90% of those new cases are related to the Delta variant. Let's keep that in mind. And if you look at the heat map, which practically shows that the entire United States is infected with this Delta variant. In fact, some of the more recent ones looks like the entire United States is red hot. That is red alert all across, and particularly Florida, Texas, Louisiana, and California are having the biggest brunt of this COVID Delta variant, resulting in tens of thousands of cases, with hospitals being overpacked with patients both on the floors and also in the intensive care units. As a matter of fact, in Houston, Texas, where I live, out of 14,400 beds available in Houston, more than 90% of them have been occupied, and there are only about 92 beds left in the intensive care unit as of August 12, 2021. That is the magnitude of this Delta variant, which is sweeping across the entire United States, particularly affecting the southern states like California, Texas, Louisiana, and particularly Florida. And talking about Florida, as you can see, the number of new cases have skyrocketed to a point which is bigger than what were seen during the second wave and also during the first wave and the summer spike we had last year. And Florida recorded as high as 28,000 cases per day. They have come down in the last couple of days, but still Florida has also recorded the increase in deaths, and they are also scrambling for beds. In fact, multiple states are sending ventilators to the state of Florida and Texas to manage these sudden insurge of inpatients and need for intensive care unit beds. Here is a chart from Texas which is showing a similar picture. We had as high as 16,000 new cases recorded in Texas, and it is still not showing any sign of a peak or a plateau. So we may be in for several weeks of continued increase in COVID cases, putting a tremendous burden on the healthcare system, particularly the healthcare providers, the hospital beds, and the supplies. Here's a chart from the Texas Department of Health and Human Services. As we can see, on August 11th, they had 14,000 cases with 10,463 patients in the hospital. Just a month ago, the number of patients in the hospital were less than 1,000. So there's been a tenfold increase in the number of hospitalizations related to COVID here in Texas. So this is the magnitude of problem that we are facing all across the United States, particularly so in the southern states like Texas, Louisiana, Florida, and also California. Now let's talk about what is causing this sudden surge. This has been mostly attributed to the Delta variant, which was approximately 20% back in June of 2020. But as of August 2nd week, the Delta variant accounts for more than 90% of the cases here in the United States. Obviously, the Delta variant originated in March of 2021 in India. From there, it has spread to more than 140 countries, and this has caused a havoc both in Europe and now here in the United States. First, we had the Alpha variant, that was the Kent variant from the United Kingdom. Then we had the South African variant, we had the Brazilian P variant, and of course, the original was the one from Wuhan, China. So keeping that in mind, let us make some observations about how is this Delta variant different from the original Wuhan, China COVID virus. As you can see, the rate of spread with the original virus was like 2.3. That means one person could spread it to 2.3 adults, but this Delta variant can spread it to like 5 to 6 people. So that means there is a twofold increase in the number of people it can spread to. So it can rapidly spread. Number two, it also creates severe symptoms compared to the original variant. As a result, people get sicker and they end up in the hospital emergency rooms. They also end up needing intensive care units, and most of the deaths reported in the hospitals are resulting from patients having the Delta variant. Before we go into the booster dose, I want to talk about the vaccine. The vaccine has been quite effective in preventing serious hospitalizations among patients with even the Delta variant. Vaccines have been effective in reducing the mortality related to all variants of COVID infection. Vaccine has also minimized the need for the intensive care units. Now the question is boosters. You heard booster doses being talked about in the media, on the cable channels, and let's talk about why do we need a booster shot. The story of booster immunization is nothing new. This has been used since our childhood. For hundreds of years it's been used. And as you remember, when we were children, we were given like mumps, measles, and rubella. They were given in 2 or 3 doses. Similarly, polio, oral vaccine was given in 2 or 3 doses. Same thing, tetanus shot. If you had a tetanus shot 10 years ago and you get hurt with a metal object, the first thing they're going to do is when you go to the emergency room, they're going to give you the tetanus shot. We get flu vaccine every year. We don't question about it. 165 million people get flu vaccine. Why do we get flu vaccine every year? For 2 things. Number 1, the flu vaccine antibody response wears off with time. That's number 1. Number 2 is the new viruses or the new variants which are emerging during the past year have to be included into the vaccine. As a result, the vaccine serves not only to improve the immunity to the existing viruses, it also improves the efficacy of preventing new viruses that have appeared last flu injection was given. So these are the same principles we are talking about when it comes to COVID infection and the need for booster doses. And as far as vaccines are concerned, multiple doses is no news. If you pull up your old immunization records from your school days, you will see that your diphtheria was given like multiple times, the same thing with oral polio. So this is just to boost your immune system to a point where you have adequate coverage for the duration of the time it is required. The CDC says that if a patient has been fully vaccinated 2 weeks after the second dose, they should have significant coverage for all variants of COVID-19, which is theoretically yes. In patients who have received vaccines, say for example last month, they have almost 80% protection against the Delta variant and almost 90 to 95% protection against the other variants. So it is not 100%, It is not 95%, it is 80%, which is considerably better. And that is why when vaccinated people get infection, they have milder symptoms, they need less hospitalizations, and their death rates are lower. But the second point is that depends on when you got the vaccination. What is the timing for the vaccination booster dose if it is needed? The timing is exactly when we need it. When is the booster dose needed? Let's look at when we start off initially, let's say in January and December, all of those healthcare workers who received the vaccine, they got their 2 doses, the antibody levels built up, and they were able to address the variant 1, which was in existence at that time. Then we had a pretty good protection over 6 to 7 months. Now the antibody levels are coming down. Our ability to fight infection is going to go down. As a result, we have to boost the immunization by giving a booster shot. When we do that, again we get increase in antibody levels that will protect us over a period of several months. And this is a concept of vaccination, especially for flu, where the respiratory viruses can change every season. And if that is having a problem and we get a new variant, then we may have to give another booster shot to increase. And during this booster shot, the new variant may also be included in the vaccine research and manufacturing so that it addresses the specific variant virus itself. So this is the reason why we need a booster shot to begin with. Now, if we look at the efficacy of the Pfizer-BioNTech or the Moderna in terms of preventing infections in patients who are having Delta variant, this chart helps us to understand that. And when we had the original virus, the protection was almost 95%. Let's talk about just Pfizer and Moderna, the 95%. But when it came to Delta variant, the protection was much less than 90%. It was close to 80%. That was 2 weeks after the last dose. As we move further away from our vaccination time, as each month we are going to lose the efficacy of the vaccine to give protection. And that was a study that was done in England, which looked at people who had received vaccination during the early part, and later on the efficacy dropped to 60%. Israel has done the largest field study. They had more than 9 to 10 million people of their population injected with Pfizer-BioNTech vaccine. Majority of them have received 2 doses of vaccine. So they followed these patients who had received vaccines back in January of 2021 systematically, and they came up with the conclusion at the present time Delta variant is a predominant virus in Israel, and the vaccines are only 38% overall effective. We're going to get a breakdown of this and see what sense we can make out of this. All right. Wall Street Journal reported that FDA expects to have a strategy on COVID-19 vaccine booster doses by early September. And this may be particularly directed to people who are greater than 65 years of age and people who have immune compromised system. In fact, FDA just recently approved the COVID booster dose for people with the immune compromised system. And it is also going to be available to people who received the vaccine in December and January, and particularly the frontline workers, the healthcare workers who are going to be exposing themselves to this sudden surge in the Delta variant. They are the ones who need to be getting these vaccines, and I will be the first one to get this vaccine as soon as it is commercially available. And the Israel study, I want to elaborate a little bit, which has been the foundation for pushing these vaccines, booster doses, to be seriously considered and given in appropriate patient populations. Here's the Israel study. I just showed you that this is all written in Hebrew. I don't understand Hebrew, but I just wanted to let you know this was a study reported. And let's look at some important data. And they found that the Pfizer-BioNTech was only 39% overall effective in preventing COVID-19 infection with the Delta variant. It was 40% effective in preventing symptomatic COVID infections. In fact, it reduced hospitalizations by 88% and severe COVID infections by 91%. The more important point which I want to bring to your attention that has driven most of the medical experts to move forward with the COVID-19 booster dose is this particular chart here. And this is the chart, the same Israeli study, which looked at the overall incident protection was 39%. We talked about that. Then those people who had received the vaccine, say in April or March, this is the yellow and green, they had like 67 to 75% protection. And those who had received the vaccine in February had 44% protection. And remember, look at here, January, that's almost all healthcare workers, doctors, nurses, technicians, and all people who work in intensive care units and on the floor. They have only 16% protection. Given this number, it should make sense for any scientific person or any logical person to understand why there's a need for a mask even though you have been vaccinated. Yes, you were vaccinated back in January and February, just like I did. But when I go out, I am at an increased risk of catching this Delta variant because my protection is of a range of 16 to 20%. And that's why I think it makes sense to wear the mask and continue with the self-mitigation guidelines until such time we have the vaccine available as a booster dose. Just to summarize this chart which I was talking about, here as we can see, 79% protection if you received the vaccine dose in April. If you received it in March, it is like 69% protection against the Delta variant. And if you received it in February, 44%. And if you received it in December or January, you might as well as roll up your sleeves and get ready for the booster dose, especially if you're going to be in the front lines facing active COVID patients with the Delta variant. And in order to address that, the FDA has just approved the COVID booster shots for immune-compromised Americans, whereas Germany and France are already going ahead with the booster doses for COVID patients in September, and Israel is also gearing up to give the booster doses. Now you know as why you need the booster vaccine dose and when you need it, depending upon when you had the vaccination to start with. Ladies and gentlemen, you have been watching the COVID-19 World Pandemic News. I am Dr. NIK NIKAM, and please do subscribe to our YouTube channel, and we will see you next time.